Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that I have every Monday at 9 p.m. Eastern Standard Time. This is my chance to answer any of your questions live that you put into the chat, as well as my chance to answer any questions that you might have submitted onto the channel this week. Remember, we're on Facebook, Instagram, and Twitter for additional content, so please check us out over there. Please share the channel with your friends and family, and really please subscribe. Subscribing really helps content creators out like myself. For those of you who were with me last week, you may have remembered that I had COVID. I still have COVID, so I am sounding a little off. And I also literally had hiccups up to 10 seconds before I hit the live button. So let's hope my hiccups don't come back. So if I sound a little off or under the weather, that's why I sound that way. So I'm going to go ahead and get started, and we actually have a question already in the chat, which is awesome. So we're going to start right there. And then, of course, please feel free to put any questions that you have into the chat. So good evening, Silenthia. Just had an IUI last Monday, found out I have a UTI, had no symptoms except frequent urination. Is it fine to take antibiotics during the 2-week wait, especially at time of implantation? So for those of you guys who are not aware, IUI is intrauterine insemination. It's one of the procedures that can happen when somebody has fertility issues. So we go ahead and we do an insemination ourselves directly. And a UTI is a urinary tract infection. So what I will tell you is, Silenthia, there are plenty of antibiotics that are safe for use during the first trimester of pregnancy. In fact, what I recommend for a lot of women who are of childbearing age who are not trying to prevent a pregnancy from happening, you should be asking all of your healthcare providers to always medicate you with medications that are safe for pregnancy, because you never know when you could get pregnant. It is extremely important to treat urinary tract infections. Urinary tract infections are one of the number one causes of miscarriage, preterm birth, stillbirth, etc. And it's because when your body is infected, and especially if you have an infection near the uterus, then you have potentially bacteria going into that bloodstream, and it can create a very hostile and toxic environment for a pregnancy to try to grow. It usually creates a lot of uterine irritability, which can also cause a miscarriage to happen. So really, there should be a medication that they can prescribe to you that you could use to take. And unless they're telling you not to take it, I would be taking the medication that they're offering. What's really, really important, and I tell a lot of people this with antibiotic use, we hear a lot about antibiotic resistance. And the way that came about is, unfortunately, when you have a bacterial infection, when you take an antibiotic and it starts to kill off that bacteria, you start to feel better really quickly. But so then it's very tempting to not take all of the antibiotics, because especially if we think we are pregnant or could be pregnant, we want to make sure that we're not exposing our babies to anything that we consider to be toxic. And medications are oftentimes viewed that way, even though they're very, very beneficial. So when you start to take an antibiotic, you start to feel better. And then a lot of people will stop taking that antibiotic. And that is not a good idea, because what happens is there's still bacteria that's left over, and it builds up a resistance. And then when you go and you start to go about life, you get sick again. And so then you're like, oh, I should have taken all the medication. You restart the medication, but this time it doesn't work as well. And so because it doesn't work as well, it's very hard for us to fight that. And then when we do that, when we end up like trying to treat it again, we have to use something stronger, which might not be as safe for the baby. So that's really important for you to understand with all of this, is that if you're going to take the medication, you need to take it in its entirety to its completion. And you're not alone in this concern about taking an antibiotic. Antibiotics can be very scary. And the other problem is when we talk specifically about urinary tract infections, there's a lot of misinformation out there that says that you can actually treat a urinary tract infection with like homeopathic remedies, like for example, cranberry juice or something like that. For those of you guys who aren't aware, urinary tract infections, if you have a true urinary tract infection, established bacterial infection, it cannot be treated with stuff like cranberry juice or garlic or any of that stuff. That is not true. There is no evidence, there is no studies, nothing. Furthermore, even if you could find somebody in your life that said, oh, yes, I do this all the time and it always works, I would ask you to ask them, okay, but were you pregnant? Because a pregnant woman is immunocompromised. And a lot of people don't realize that. Your immune system has to be like, it basically calms down when you're pregnant because otherwise it would attack your baby. Your baby appears as a foreign body or foreign organism at first. And the body, your immune system, it doesn't realize that that's supposed to be there. So if the immune system naturally didn't kind of dampen or quiet down, you'd be attacking your baby. When our immune system quiets down, that means we're more likely to get other infections. So that's why, for example, COVID-19 or influenza are extremely dangerous to pregnant women because we're immunocompromised, which means we are at greater risk for getting a more severe infection. So again, because of that, when you talk about something like urinary tract infection, which is very common and for many women may not be that big of a deal, for a pregnant woman, it could be life or death because a urinary tract infection that is left untreated ends up becoming a kidney infection. So what happens is you have your bladder, okay? So at the bottom of your bladder is a urethra, okay? So the urethra is just a little tube. It's like a straw. And it goes from your bladder to the outside by your vagina. That's where the pee comes out. And it's very short. And this is why women are so prone to urinary tract infections because it's so short. And if you wipe wrong, you can get like stuff, like basically the bacteria travels up and into the bladder. Now, when you're pregnant, what happens is you're not always able to empty the bladder completely. The bladder is where it's like a balloon and that's where the pee sits. So if you have any pee that gets left over and sits in there and it's got bacteria in there, well, it's warm and it's dark and it's the perfect environment for that bacteria to flourish. Now, from your bladder, if you go up, you have two urethras, these tubes right here. Okay, and these tubes go up to your kidneys, and your kidneys are where urine gets made. Its blood comes into the kidney, it gets filtered, and urine comes out and goes into the bladder. So because of that, your kidneys are full of blood vessels. So if your bladder is full of an infection and that infection travels up the ureters into the kidneys, you're going to get a kidney infection. And a kidney infection can turn from a kidney infection, which is called pyelonephritis, into sepsis, which is a systemic blood infection, so quickly. And that's why it's important to treat it, okay? If you have a urinary tract infection, there are no homeopathic treatments that are proven to treat. Now, if you are prone to urinary tract infections, using something like, for example, cranberry juice or cranberry pills, that has been known to reduce your risk of contracting one. Because what that does, for example, is that goes ahead and it acidifies the urine that is being made. And because the urine is more acidic, the bacteria can't grow as well. So it can help prevent, but it does not treat. Okay? Now, the last thing I'm going to tell you, because this is kind of in this same realm, is that we get lots of questions about antibiotics and stuff, which comes along with the urinary tract infection. So I do have an antibiotics use during pregnancy video that I would tell you to check out. I got a comment on one of those this week, and it said, how about co-amoxiclav? So co-amoxiclav is one of many examples of antibiotics. And this particular antibiotic is also known as Augmentin, and Augmentin is safe for use during pregnancy starting in the first trimester. So this might be an option to treat your infection. So I hope that helped. Jeffrey, you see my daughter. Thanks so much. She has comfort with you. I am so happy to hear that. And for many of you guys who are unaware, I actually do practice. I do private practice in psychiatry, and it is one of the best pleasures that I have to help moms and dads when they are struggling with mood disorders, both during pregnancy and postpartum. I'm going to go ahead and I'm going to start answering some of the other questions that we have. I would like to, this is another one of the antibiotics. I would like to ask if there's a possibility of a birth defect. I took ofloxacin during my 3-week pregnancy, and I took it 5 days twice a week. 5 days twice a day. So I think she was 3 weeks pregnant, and she took this for 5 days twice a day. She didn't know she was pregnant. So one of the things that I want you guys to know is that we all, as medication providers, any of your medication providers, we all not only get specialized training in like medicating, but we also get access to evidence-based like resources, stuff like LactMed, Thomas Hale's Infant Risk Line, etc. These are different places that pharmacists, doctors, nurse practitioners all have access to, and we are taught how to use it. So if you ever have a question on some of these medications, you have more than one person you can go to. In fact, the Infant Risk Line is available for more than just myself to use. It's actually available to the public, because the important thing out there is for you to get proper education so you are making good decisions, and more importantly, that you're following the plan of care your healthcare provider has given to you. So I've been there, and I understand why we can't just always blindly follow our healthcare providers. I've seen and heard the same stories you guys have. But at the same time, you cannot be skeptical about everything. So it's always good to get a second opinion if you're unsure. I'm a firm believer in second opinions, because none of us are perfect. But once you are given a plan of care, if you are told you have an infection, you should take a medication. If you are unsure of that, you need to get your second opinion immediately. Okay? And that's why I think a lot of people try to check this out. One of the things I was looking right now is at ofloxacin. Ofloxacin is an antibiotic that can be used during pregnancy, including the first trimester. Now, this is a fluoroquinolone. So that's a category of medications that we don't know a lot about with pregnancy. Now, if you have certain types of infections, certain fluoroquinolones are the most, they are the best antibiotic for that bacteria. So one of the examples is Levaquin for pneumonia. Okay, so we try not to use this category unless we need to, and it is a stronger category of medication. Now, there is no reason to believe that this category of medication would have any issues during pregnancy. This, however, is a great example of why when you're getting medicated, if you are not protecting yourself from pregnancy, you want to say to every provider, is this pregnancy safe? Make sure you're giving me something pregnancy safe. Now, the last thing I want to say is that even if you've heard a medication causes a birth defect, we don't want to use a medication if we know it causes a birth defect. A great example is lithium. Lithium can cause heart defects. We know this. Epstein's anomaly. And so lithium is contraindicated during pregnancy. However, people sometimes get pregnant on lithium. They don't realize there's a mistake, something happens. There are plenty of babies that are born that don't get Epstein's anomaly, even if the mom was taking lithium. Now, do we keep her on lithium? No. Do we absolutely get her off and move her to something else? Yes. But just because medication that can cause a birth defect doesn't mean it would. Okay? For those of you who are joining me, hi, I am Dr. Samantha, the maternity mentor. Please feel free to put your questions into the chat. If you guys didn't see me last week, I had COVID. I still have a little bit of COVID, so if I sound funny, that's why. I'm going to go ahead and answer a question from one of our videos. So we had a question on yeast infections of the breast. So it was an interesting one. And the question started out, and I think basically the way the question was starting is, can you get a yeast infection in the breast if somebody has not breastfed or had a baby or anything? And the scenario is, this occurred after taking 1 dose of cefixime, 400 milligrams on the second day, and 1 dose of fluconazole, 150 milligrams on the first day. The nipple and the areola burning started on the second day and a half or third day. Both nipples became sensitive to touch. Is it because of the cefixime, or is it a serious issue that should be checked by the gynecologist? This appears after taking cefixime and fluconazole. Fluconazole was prescribed by a general physician for vaginal burning sensations, while cefixime was prescribed by the doctor for a urinary tract infection. Okay, so this was an interesting interesting question, and I think it's actually a really good way to talk about breast yeast infections. So for starters, the biggest, oh my gosh, you have a breast yeast infection symptom is deep, sharp, stabbing pain or itchy nipples. Those are like the two ones, okay? Breast yeast infections are very common. They usually get passed back and forth between mom and baby when she is breastfeeding. In this question, it seems like we have somebody who is not breastfeeding and has not had a baby. So how is this possible? Well, one of the things that was said was that this patient had a vaginal yeast infection. Fluconazole is a tablet, it's Diflucan, I believe is the brand name, that we use to treat vaginal yeast infections. We can actually also use it to treat breast yeast infections. Now, if you've had a vaginal yeast infection, and to be very frank, you touch your vagina, you don't clean your hands right, and you touched your breast, and your breast had any kind of open area, you can give yourself a breast yeast infection just like that. Yeast nowadays is extremely contagious. That's why it goes back and forth between mom and baby when a mom is breastfeeding. So you have to be very careful with hygiene. We take that for granted, but it really is a very big deal. And so is it possible that that is how this person got the yeast infection? Absolutely. Irregardless, since there is no breastfeeding happening, I would absolutely see an OBGYN because you want to get a breast ultrasound. You want to see what is going on in order to determine the next plan of care. But it's extremely important that you have good hand hygiene when you're talking about like dealing with an infection on any part of your body and then touching other parts of your body, okay? So I hope that answered that person's question. For those of you who are joining me, please feel free to put any of your questions into the chat. Okay, I have a couple questions that came in on drying up breast milk. For those of you who don't know, I have been a lactation consultant for 13 years. I'm very pro formula and pro pacifier. And so I think it's very important that we support moms who want to breastfeed, as well as moms who tried to breastfeed and couldn't, as well as moms who don't want to breastfeed, and everybody in between. And some of that involves also drying up breast milk. So the question is, I was actively breastfeeding for 4 days after my daughter was born. However, she didn't agree with my milk and ended up projectile vomiting. She also didn't seem full and cried a lot. For both her health and my mental well-being, I made the difficult decision to stop breastfeeding and switch to formula. The hospital advised me not to pump and to just wear a tight sports bra to quit cold turkey. But based on your video, I now realize that was the wrong approach. I tried using cabbage leaves, cold compresses, drinking peppermint tea, but I was still engorged. I went to the doctor and was diagnosed with mastitis in both breasts and prescribed strong antibiotics for 10 days. I desperately need your advice on how to dry up milk, ease the pain and uncomfortable situation. Thank you. I really hope you see this message. So this is a really great example of why this is so complicated. So for starters, one of the things that people are often told is like to basically really tight compression on the breasts. And the idea behind that is if you have the milk ducts, they're basically um, they're basically like little balloons, right? So like a balloon can fill up as long as it has space. So if I compress this balloon, I have less space for it to fill up, I make less milk. So the more I keep the balloons closed, the less milk I can actually physically make. And that's actually why some women who have breast implants, they have trouble making milk. Because when we talk to people who have had breast surgery and have an implant, we ask, is your breast implant under the muscle or is it over? Because when we have an implant that's over, that implant actually smushes down breast milk ducts and it makes it harder for these women to actually produce enough milk. And that's why nowadays most of the implants are underneath your chest wall muscle, underneath back here, so they don't interfere with that part. So when you are talking about a sports bra, the idea is to flatten out those ducts. But the problem is that actually cuts off circulation and like flow of milk, which creates mastitis and clogged ducts and all that other stuff. So really all it's about is having support, having a nice firm bra, but nothing too tight. Now, the next thing is it's really important to avoid stimulation, and we really need to be clear about that. That's one of the other reasons why a bra is used, because believe it or not, just having a shirt rub against your nipples is enough to stimulate milk flow. So when you have a bra on and you put a, like say, a breast pad in between the bra and your nipple, you basically minimize the most stimulation and therefore send the least signal to your body to make milk. Now, another question that I got was, does allergy medications drying up breast milk, does this include antihistamines, which is stuff like Benadryl and Zyrtec and Allegra, as well as like Sudafed? All of those medications can help to dry out breast milk, okay? All of them. In fact, it's very common, and one of the things that I tell people, talk to your healthcare provider. If it's safe, ask them if you can use Sudafed during the day, and ask them if you can use Benadryl at night. Now, for those of you who are at least in the United States, I'm thinking it might be like this in Europe, but I'm not sure. Sudafed. So the actual real Sudafed is has the active ingredient pseudoephedrine, and pseudoephedrine is controlled, at least in the United States. So you can't buy it over the counter anymore. You have to go up to a pharmacist. You have to show them your ID. They put your name in a registry, and then they sell you the medication. And this is because that medication is the primary ingredient in producing the illegal substance methamphetamine. So any Sudafed product that you see just sitting on a shelf that you can just grab, that is not actually Sudafed. So that might help a little bit. It's usually, though, it's phenylephrine, and that's not really as effective as real pseudoephedrine. Now, the other thing you need to know about Sudafed is that it can actually increase your heart rate and it can increase your blood pressure. So you actually need to make sure you've asked permission from your healthcare provider who knows your health history to see if Sudafed is safe for you to use. However, it is fantastic if you can use it because it really does help dry you up. It can work pretty quickly. It usually doesn't have any negative impacts on your mood. And it can give you a little bit of a pep those first couple of days when you're just in a blur. Now, on the back end, Benadryl. Benadryl is also an allergy medication. It is meant to dry you up. It's meant to dry up secretions. Benadryl also has a side effect of making you sleepy, and Benadryl can help with anxiety. So, Benadryl is a great option at night. It can help you sleep, but it's not going to necessarily knock you out so you can't take care of the baby, and hopefully it helps to dry up your milk. So these are all really good things to hear about. Now, a lot of women are not given the guidance of, like, if you have plugged ducts, happening, if you're starting to get so full, you're feeling lumps and you're getting red spots and all this other stuff, then you need to go ahead and you need to hand express off some of the milk. Okay. Yes, expressing out a little bit of milk can stimulate a little bit of milk, but ultimately it helps prevent mastitis, which is what we're trying to do. The other thing is some OBGYNs are well-meaning and they will offer you something called cabergoline or bromocriptine. So cabergoline, bromocriptine, it's the same drug, is a medication that's used to help dry up milk. And it is fantastic because it reduces your prolactin levels. Prolactin is the milk making milk quantity hormone. And bromocriptine is really good at reducing that. The problem is one of the side effects of bromocriptine when you take it is it actually makes you feel happy. And a lot of people are like, wait. Why would you not want to take something that dries up your milk and makes you happy? Well, you can only take bromocriptine for about 10 to 14 days. And then after that, they take it away from you. And when they do, you get a significant drop in your mood. It's just awful. And bromocriptine is actually a very big cause or trigger for postpartum depression for a lot of women who don't even realize it. And when providers are prescribing this medication, they don't realize, they're not thinking about it in that perspective. They are prescribing it because they're trying to solve a problem, and the problem is drying up milk, and it works. It does a great job. The other thing is, if they're not thinking from a mood perspective and you stop your medication and 2 weeks later you have postpartum depression, they probably aren't putting two and two together, okay? So well-meaning providers continue to prescribe this without thinking, but that is actually a big deal. So I would tell you not to use that, okay? And I would tell you to just stick with some of the stuff that's on the video. The nice thing is also, if you are going to be formula feeding anyway, you can use all of the herbs and stuff that are in the video to help dry up your milk also. And the last thing is, sorry guys, COVID. The one question mentioned drinking peppermint tea. Peppermint tea is awesome. The other thing you can do is you can actually use peppermint essential oils on your breast or peppermint essential oil deodorant. The only thing is you don't want to get any essential oils on your skin that the baby could get on their skin, because essential oils on a baby's skin is oftentimes a little bit too strong. And so then it ends up being, it can give them rashes and stuff like that. But I'm going to tell you, it's so funny. The first time I really understood the power of peppermint oil was when, on like a topical basis, was when I had a patient who had a significant drop in their milk supply. She was trying to breastfeed, and we went through every single thing we could think of, and she was doing every single thing in her power to increase her milk supply. And we were just troubleshooting for weeks until all of a sudden she happened to mention this deodorant. And I went, oh my gosh. And that was it. As soon as she stopped using it, her milk supply bounced back up. This is different from the current topic, but I've always wondered about moms with lupus and the effects on the fetus neonate. I often see babies with AV blocks. Does the AV block go away with time? So, those are kind of, in my opinion, two different kind of questions. So I'm going to tell you the first part and then the second part. So lupus. I have taken care of a lot of moms with lupus. That's actually something that I've done throughout my career. I have also diagnosed a few moms with lupus. Lupus is actually a lot more common than a lot of people realize. Lupus is basically an autoimmune disease. It has a lot of effects on the entire body, okay? Autoimmune diseases are very complicated, so I'm not going to get too deep into it. But auto, self, immune, like your immune system attacks yourself. And what happens with all these autoimmune diseases is you get a variety of different symptoms. Another good example of an autoimmune disease that a lot of people are a lot more familiar with is rheumatoid arthritis. So that's the arthritis that has all the swelling and redness of the joints. Lupus has a wide variety of symptoms, and it really does attack a lot of the organ systems. And so women will oftentimes end up in the hospital, into their second and third trimester, and they're sick, and we have to try to keep them pregnant for as long as possible because their body is already overtaxed, and then a pregnancy adds on to that. Now, that being said, most of the time the babies are fine, other than if they're delivered prematurely because mom was no longer able to be pregnant. But even that premature baby is just having the normal effects of being premature. It's not like the lupus made it more complicated. Sometimes the babies are actually a little bit on the bigger side, depending on what treatment mom's getting, because with autoimmune diseases, a lot of times we use steroids to help combat some of the symptoms, and steroids actually help to mature a baby's lungs, and it makes them actually bigger and fatter. So sometimes you'll get bigger babies, but most of the time, that's like, it's fine. Now, AV blocks are atrioventricle blocks. This is actually like a heart block, okay? And it has to do with how basically it has to do with how the electrical impulses work inside of the heart. And different heart blocks have different symptoms associated with them. There's more than one. And it really just depends. I cannot tell you for sure that I've ever seen a heart block go away. But then again, I'm not sure if I ever remember truly having a heart block baby, because I think usually they are going to the NICU and it's like taking a while to get that. I have a lot of babies who have PDAs and VSDs. So VSDs are ventricle septal defect. So in your heart, you basically have like 4 chambers of the heart, and right down the center, there's this like septum, and you have the atria at the top and the ventricle at the bottoms. And then in that center is the septum, and a VSD is a ventral septal defect. Basically, there's like almost like a hole in between the 2 ventricles. And then a PDA, patent ductus arteriosus, is like another little hole that's supposed to be there in the heart for your newborn in your belly to be okay. And then once they come out, that fixes itself. So I've had a lot of babies with those. I've also had some babies with some more complex, cardiac issues that actually had to be airlifted to other hospitals. I'm going to tell you that AV blocks are not common. So I don't have a lot of experience with them with newborns, because I think they're usually being diagnosed much further on down the road in the NICU setting. Michael Jordan, I have a question about irregular periods. My wife has them. We're trying to conceive, and she just had a period after almost 2 months. So my question is, can she still be fertile during the time she is not having her period? Okay, it repeated 3 times. So just making sure there wasn't anything different. So the answer is absolutely yes. And I think this is an awesome question to ask, because a lot of people assume that they are not fertile when they have an irregular period or when they're skipping periods. You can absolutely be fertile and not have a period. Now, is it as likely? Probably not, but it is possible. One of the things that I would tell you to do is, if it is possible for you to get the cheap, not the expensive ones, but the cheap. Oh my gosh. I have one of my patients using them right now. Oh, ovulation strips. I'm sorry. COVID, guys. COVID. So ovulation strips, you can get really cheap ones. You pee on them, and every single day you take one. And then when the hormone spikes, you can tell that you're ovulating. That's your fertile period. Okay. And so what you want to do is you want to be checking so that you can actually see when ovulation is happening, so then you can plan out when you're going to have intercourse. I have a lot of patients who use ovulation strips for actually reasons, because when ovulation happens, there is a certain period of time that if your mood starts to be more depressed, irritable, anxious, for like about 10 days after that, it can be a sign of something called PMDD. So I actually have women who've had hysterectomies who still check their ovulation. It's actually a really big deal, and it really can go speak to a lot of stuff. I would encourage you also to be doing ovulation strips for the following reason. If you are doing an ovulation strip every single day and she's not ovulating in that whole two-month period, so she's going 2 full months without ovulating, well, then you want to be speaking with like a fertility